Introducing the all-new Corolla.
Good evening, Guam and Saipan. We are now wrapping up day 2 of the Guam Medical Association medical mission here in Sogod, Cebu. I'll recap day 1. Yesterday, we headed to Daan Bantayan. It's a province in the northern tip of Cebu Island. The eye of Typhoon Yolanda passed through this area. A total population of 86,000 with about 21,000 households. Mayor Augusto Coro tells PNC that about 19,000 homes suffered 50% or more damage, and about 650 homes suffered less than 50% damage. At this location, the mission team saw 595 patients. 492 of them were medical, 29 were dental patients, 21 OB, 30 GYN, 12 surgeries performed, and 5 surgical consults. According to Mayor Coro, more patients could have been seen. However, there was virtually no communication as the area is still without electricity. On day 2 this morning, we headed for Sogod, Cebu. As we arrived at the Data Durano Sports and Cultural Center, we were met with a larger crowd. Mayor Lisa Marie Gunagan says a total of 18 barangays or villages were a part of this mission. There is electricity in this area, so the local government was able to contact residents more effectively. The media left the mission before it ended, but I would venture to say there were easily more than 1,000 patients seen on day 2. Some of the patients who came through this area appeared more ill and in need of medical attention. There was a 4-year-old child who went into seizure while being assessed. The nurses and doctors were quick to bring his fever down and get him on an IV drip. Within minutes, the little boy was awake and alert. Dr. Eusebio, the only surgeon on the team, performed many surgeries, procedures these patients would not be able to otherwise have done. There had to be dozens of tooth extractions performed by Dr. Roger Kenshiro. Dr. Tom Shea, OBGYN's makeshift ward, had a long line of pregnant women waiting to be seen. He brought a mobile, state-of-the-art 4D ultrasound machine. Most, if not all, the expectant mothers heard their baby's heartbeat for the very first time. Dr. Shea even performed an external procedure in which he turned a fetus around into the correct position for labor and delivery. He is supposed to return to Guam tonight. However, he has decided to stay back an extra day after seeing the faces of the patients, excited and sometimes desperate for care. Truly, these doctors and nurses put their heart out there, running on a few hours of sleep. Chief Logistics Officer Pat Lujan says the mission so far has been successful. In just a matter of hours, a small team of doctors and nurses from Guam changed thousands of lives. Reporting live from Cebu City, I'm Janela Carrera.